Hello, my name is Eric Nee, and my proactive health communication plan is on at risk groups in Alameda County. Similar to the city of San Francisco, a large at risk population in the Alameda County region is the homeless. Homelessness has skyrocketed up to 5,629 people as of June 2017, up by 39%. Half of the homeless population occupies the city of Oakland, California, where islands on the street and areas under the highway are sometimes occupied by tent cities, shelters, and cars. Demographically, Black Americans make up the largest portion of homeless people by ethnic group, 49%, and the majority, 86%, identify as single. Almost one third of the population is made up of families and children. Officials believe that the large increase in homelessness is attributed to the lack of affordable housing, in addition to continually increasing costs of rent. Data on homelessness is more accurate now due to the use of homeless people aiding volunteers to help find others that are also homeless. Although counts of homeless people have recently become more accurate, it is likely that the large number counted is still directly related to the problem of homelessness progressively growing. Of these homeless persons, many have previously been incarcerated or have been in foster care of some sort. Additionally, 560 of those homeless people are living with HIV or AIDS in Alameda County. About 34,000 people of Alameda County, or 6%, are at high risk for homelessness due to their low income statuses and the need to pay more than 50% of their income on rent or housing expenses. Health risks are largely prevalent within the homeless population in general. Homeless persons experience the same illnesses as people with homes, except their rates of illness are 3 to 6 times higher. Approximately one third of the homeless population in Alameda County has a chronic substance abuse problem. Mental illness is also largely associated with the homeless population in Alameda County. In a survey taken in 2013, 1,106 homeless people identified themselves as having a severe mental illness, which was increased from 818 in the year 2011. Over the last decade, severe mental illness has nearly doubled in those homeless populations in the county. In general, the homeless populations are often more exposed to the elements and thus have poorer health and higher mortality rates than those persons with homes. HIV or AIDS has become a leading cause of death in the homeless due to a combination of factors such as poor living conditions, limited access to resources, and the higher prevalence of infection. A study done in the neighboring city of San Francisco revealed that the homeless population had an HIV prevalence of 10.5% in comparison to the general population of San Francisco. Additionally, the same study revealed that the homeless men who have sex with other men had an HIV prevalence of 30% and 8% among homeless persons that are injection drug users. The factors of homelessness and HIV infection are directly correlated with one another because HIV positive persons have an increased risk of facing discrimination, while homeless persons are at increased risk of infection. Further, risky behaviors become more prominent among the homeless populations due to most shelters providing living spaces that are typically single sex. Thus, stable sexual relationships are nearly impossible for the homeless. The homeless populations are also at increased risk for substance abuse and mental illness in comparison to the general public. Approximately a quarter of the single homeless adult population suffer from severe mental illness. According to the Substance Abuse and Mental Health Services Administration, 38% of the homeless population abused alcohol and 20% abused other drugs. Moreover, substance abuse is often the cause of homelessness due to the disruptive relationships that ensue between families and friends. The onset or exacerbation of addiction may cause people to lose their housing. Conversely, substance abuse is often the result of homelessness as well, due to the lack of coping mechanisms. From a psychological standpoint, participation in illicit drug use could also be correlated to the desire for social acceptance in the homeless community. Substance abuse is often related to mental illness, as many homeless persons abuse substances in order to self medicate or treat their mental illnesses. The Stages of Change model, also known as a trans-theoretical model, was developed in the late 1970s by Prochaska and DiClemente as a process to conceptualize the process of intentional behavior change. This biopsychosocial model was created after examining smokers and their abilities to quit independently. It was developed to understand why some smokers were more ready to quit than others. It is known as a model of intentional change that involves the decision-making ability of an individual. Prochaska and DiClemente viewed this change process as gradual and cyclical. They believed that habitual behavior is not changed quickly. Further, the model incorporates stages which describe different levels of motivation or readiness to change. The first stage, known as the pre-contemplation stage, claims that individuals initially have no intention for change in the foreseeable future or within the next 6 months. Individuals in this stage learn about recommended health behaviors but do not think to adopt them. The homeless population with substance abuse disorders may be aware that they can receive help from organizations and shelters, but may not have any intention for change. The second stage, contemplation, involves the individual considering these health behaviors within the next 6 months. The homeless population may begin to consider seeking help for their addiction, but may only choose to identify the pros and cons of seeking change. The third stage involves decision, in which the individual's actions to adopt recommended health behaviors within the next 30 days occurs. The homeless individual begins to have a healthier, more positive outlook on healthier behaviors. The fourth stage, action, is a step in which the individual attempts to adopt these recommended behaviors over a short time frame or within the next 6 months. The homeless individual begins to seek care for their addiction. The fifth stage, also known as maintenance, asserts that the individuals will continue to carry out the recommended health behavior changes over a longer period of time, at least for 6 months. The homeless person who works to incorporate a healthier lifestyle, which they try to maintain for a longer period of time, is considered successful in this stage. Finally, the last stage, also known as termination, states that the individual has no desire to resume previously unhealthy behaviors and will not relapse. Addiction is no longer a risk or temptation for the homeless individual. The media is an incredibly effective route for the transmission of information to the public. While social media outlets such as Twitter, Facebook, and Instagram are great ways to disseminate information and inform the general population, most of the homeless populations do not have access to technology or communication devices. The majority of the homeless are not able to afford devices such as tablets or cell phones and thus are unable to stay current with the media. On the other hand, there are agencies and organizations that are proactive in their aid of the homeless in Alameda County. One of those agencies, Everyone Home, has an approach to ending homelessness in Alameda County. Their collaborative approach to ending homelessness involves preventing homelessness and housing crises, increasing housing opportunities, delivering flexible services to support stability and independence, measuring success and reporting outcomes, and developing long-term leadership and building a political will. A second agency, Health Care for the Homeless, helps coordinate efforts to increase access and improve care for the homeless persons in Alameda County. Comprehensive primary care and mental health services are offered through various partner clinics in the county. Finally, the East Oakland Community Project is an organization that provides emergency and transitional housing for the homeless population in Alameda County. Care for HIV or AIDS is also available through their housing facility. Through these agencies, it is possible to develop partnerships or working relations to end homelessness and also provide comprehensive care to improve the lives of those that are homeless. The use of social media tools such as Twitter can be effective methods for disseminating information to the homeless population. Through Twitter, helpful tips can be sent regarding HIV or AIDS on prevention and management, reminders to curb addiction, and reminders to call for help when they feel like they are at a loss and need someone to talk to about their mental illnesses. Tweets will serve as weekly reminders for organizations to continue their efforts towards aiding the homeless. Through Facebook, we're able to create a Facebook page dedicated to partnering with groups that reach out to the homeless. Groups can discuss necessary tools and supplies needed to educate and care for the homeless. An open forum will enable positive communication between the organizations. And these are examples of tweets and the name of the Facebook page. And this concludes my presentation. Thank you.